to the stage, sir. I kindly request Dr. K.R.C. Reddy sir to start the session.
Thanks to organizers. Thanks to the organizers. Respected former DCGI, Drug Controller General Dr. G.N. Sethi, Chairman of the first scientific session. All the faculty members and also external members who came from other universities and all the students of this very university and the most dynamic principal, Dr. Manjunathji, and all the teachers who are coordinating this program. I welcome all of you. Before starting your scientific sessions, I would like to present some of the information pertaining to the researches done in our Faculty of Ayurveda, Varanasi Hindu University, in the Faculty of Ayurveda, under my supervision. We have continuously developed certain formulations for the management of type 2 diabetes mellitus. Since we have the hospital OPD schedules as well as department manufacturing unit also in Banaras Hindu University, by keeping all the facilities, infrastructures in view, we try to make some scientific interventions in Ayurveda medicines. As you know that Ayurveda dosage forms means, I think for the student, it will be a new terminology. Dosage form means a syrup is a complete one dosage form. Tablets are complete dosage form. It doesn't link with the dose of the medicine. Dosage form is a certain category of medicines. It may be syrup, powder, or tablet or injection. Similarly, the Ayurveda system has evaluated huge number of dosage forms with their scientific basis. Among them, churna, that is a powder dosage form, and kashaya, जिसको आप काढ़ा बोलते हैं, decoction. Decoction is a liquid dosage form. These dosage form, I am not going to elaborate all the dosage forms. We have a humorous number of dosage forms in Ayurveda system, maybe around about 150 dosage forms. My senior Dr. G.N. sir is there. It is the number more than the allopathy dosage forms. Allopathy, you have only capsule, tablet, injection, serum, elixirs, lozenges, etc. But the number of dosage forms in Ayurveda which we call it as kalpana. There are number of dosage forms has been explained. Among those, still we are using churna and kashaya. The basic idea of keeping this churna as such, administering without any change in Ayurveda system of medicine, is that because the particles of the churna are the loose particles, they have more surface area, and once we administer these churnas, they will be interacting with the digestive juices with a wider surface area. Therefore, they have the specific type of drug action over the body system. Another advantage is that the churna contains fine powder of the plant materials. The plant material fine powder, naturally you know that they contains abundant quantity of the fiber material. Fiber material is such a requirement in such a disease conditions like diabetes mellitus, which we call it madhumeha in Ayurveda, and such a powder materials contains huge amount of the fibers as well as active ingredients, active principles. Therefore, they release the active ingredients. Fiber will reduce the constipation and other removing of other unwanted material which is stagnated in the intestines. It will help to separate from the intestines. That is the basic idea of the churna. In certain disease conditions only, churna are prescribed for long duration of administration. We have selected the research problem type 2 diabetes mellitus, where the patient has to take medicine lifelong for long duration. Therefore, the churna which contains plant material herbal drugs, they are safety. There because of their safety, if they use for a long duration, they doesn't cause any of the harmness to the body system. Based on these, uh, all the research problems, we have selected the disease that is a diabetes mellitus because of increasing stress day by day by changing the lifestyle in our routine life or the stress creating the inducing of the diabetes mellitus all over the world. And as our GN Singh sir already mentioned that the food items when we go towards the fast food, which is also like pizza, bread, biscuit, these are the food items which are also are causing the diabetes mellitus, increasing blood sugar, and also reducing the physical exercise. All these factors are causing increasing number of diabetes mellitus all over the world. The statistical data shows very clearly the increasing number of the diabetes mellitus. So we have focused on this disease, and Ayurveda very clearly has mentioned the basic characteristics of the food which causes diabetes like guru, snigdha, amla, lavana, etc. And excessive sleep, asya sukha means sitting comfortably for long duration, not doing any physical work. All these are the causative factors. Now, I am not going to stress on the diagnosis or the etiology of the diabetes mellitus. I am focusing on the medicine. So directly let us go to the medicine part, which is required from Ayurveda actually. These are all the different complications of the diabetes mellitus. Now you see, as you know, Vaishya Ratnavali, most of the students and faculty sitting over here in they will be knowing the Vaishya Ratnavali, one of the biggest compendium of Ayurveda. contains a huge number of formula of huge number of Ayurveda formulations. Similarly, in southern part of India, Vaidya Chintamani was the another huge compendium which contains huge number of Ayurveda formulations, and I was grateful to the to born in southern part of India so that I can read the ancient Telugu language. This book was written in ancient Telugu script. The Sanskrit sloka also was written in those script. When my father was a teacher of Telugu language, he taught me. So therefore, I wrote all the sloka into Devanagari script. Language was the script Telugu, but language was Sanskrit only. And in that book, there are fantastic formulations. We have selected one formulation called Talapotaka Churna. One of the faculty from Hyderabad sitting over here, Talapotak means it is called Tanged in Telugu language. Talapotak is Avartiki, and the yellow color flower, which is abundantly available in Maharashtra, Karnataka and Andhra Pradesh, Telangana regions. And another drug, Amalaki and Dar Haldi and Haldi, Dar Haridra and Haridra, Kurkuma Langa and Berberis aristata. These are the four simple ingredients made into powder. Talapotak, the cassia auriculata, is the major ingredient. Maximum quantity contains this formula. Therefore, it is the major formulation in this major ingredient in this formulation. So it is called Talapotak Churna. And this Churna we have studied clinically as well as by doing experimental study over animal study, albino rats, as well as we have also done the animal study, analytical study. Ultimately, we could able to publish in certain journals like high impact journals like Frontier Pharmacology, which is having 5.5 impact factors, sir. So these are the ingredients and powder made by using these drugs, and the work was published in Frontiers Pharmacology with high impact factor. And similarly, all animal study also we have published by using streptozotocin model in the albino rats. We induced the diabetes in the rats, and we administer the medicine. That pharmacological study, preclinical study also we have published, and blood glucose lowering efficacy study. We have made that why this ingredient Talapotaka is having producing more effect. Then only that particular ingredient powder also we have studied. Comparative study we have published, and the comparative animal study also we have published, and clinical study also. In CSIR, IJTK, that is a journal under the CSIR, NISCA, with the impact factor. In that also the clinical study has been published. So the main aim is that doesn't feel shame that by seeing the terminology of Churna, Vati, Avaleja, etc., you explore. I request all the young generation of students sitting over here, you have to explore all the medicines scientifically by using the modern technology and by modern parameters, then make it used for public. The reason of taking this selective formulation is that Talapotak drug Cassia auriculata is widely available in the Maharashtra forest, so that it is not having any cost and only labor charge, collecting charge is the cost. So that you have to invent certain medicines which are cost effective. For when you go for large population, for the benefit of the large population, you have to find out cheaper medicine which can be afforded by all the common persons. So that is the aim of this clinical study in our hospital. Further, we have made another step by taking collaboration from Dabur India Limited. In Ayurveda, we use काढ़ा, क्वाथ, कल्पना, जिसको कषाय भी बोलते हैं. उस कषाय को केरल में यदि आप जाएंगे, गवर्नमेंट आयुर्वेदा हॉस्पिटल त्रिवेंद्रम में, patients will be standing in a line for taking kashaya, which are prepared daily, instant kashaya with empty bottles. Since from my early student life, I found that the kashaya is one of the innovative dosage form of Ayurveda. So let us try for this. But the present day, the person is not having time to boil raw material and drink that medicine, kashaya, every time. So we have to make kashaya available at every place. So instantly it can be made every place during journey in the office, by sitting in the office, or by traveling, by airport, any place, a cup of kashaya, if anybody want to take, it can be made easily. So for that purpose, we have tried to make instant kashaya by using the pasteurization technology, how milk powder will be made, and by same technology, the milk powder, when you mix in the hot water, milk will be prepared instantly. Similarly, we have made the spray dryer powder, and that powder in a prescribed dose. If you mix in a cup of water, it will be prepared into a decoction. That how we have done briefly. I will show you within a 15 minutes, as you have another scientific sessions also. This is all regarding Madhumeha and decoction. I'm not going to elaborate all this, Vata Kalpana, and here we have made a step that the decoction which is prepared by traditional method, it should be advised to take within 24 hours. But however, the spray dryer powder we have prepared, that can be used up to 2 years. So shelf life also we have enhanced. For this purpose, raw materials we have authenticated by Sanat Industry, which is the sister concern of Dabur India Limited, Delhi. And these are the raw materials. Four raw materials: Lodra, Haritiki, Musta, Katpal. All the botanical names like Simplochus racemosus, Mirica negi, Cyperus rotundus. Our GM Sar knows about this Cyprus rotundus. It is abundantly available in Madhya Pradesh also. This is the Nagarmota, sir. So, by using these four ingredients, again, this formula was mentioned in Vaidya Chintamani, that South Indian compendium, and there is another compendium called Basavarajiam. There it is told that Madhumeha Jit. That means it will win the Madhumeha. It is having clear-cut efficacy over the diabetes. Based on that context, Sloka evidence, we have selected this formulation and we made all efforts to establish it, make available to the person in the form of kashaya. But this is not done within a 1 year. It was done round about 9 years. First, my idea is that by using this kashaya extract, we have made the tablet. Tablet also easy for intaking. Then tablet was studied clinically in Institute of Medical Sciences, BHU, given very good, wonderful results. Then further, I got idea that why instead of tablet, as mentioned in Ayurveda, decoction, if it is mentioned, let us do decoction only, but in modernized form. So that again, same formula, again we studied in the decoction form, and this was prepared in 3 batches, ABC batches in different liters, 890 liters, 860 liters, 620 liters, like that. Briefly, I will show you how we have prepared. Every step we have recorded the temperature in the spray dryer machine and the quantity of the raw material used and the air pressure in the spray dryer machine, everything standardized scientifically so that reproducing of the same medicine can be done by any industry very easily. Uh, he is the Varun Kumar Singh, my PhD scholar who worked on this topic and presently is working in the Dabur India Limited, Delhi. And while working, the raw materials are taken over like this. This is the container washing pot and see large scale decoction how we have prepared and the PhD scholar is observing how the decoction is formed and its consistency and other factors, organoleptic characters of the decoction. And all the parameters were recorded like temperature, pressure, vacuum, heater, pressure, temperature, everything, steam pressure, etc. And this is the mission called spray dryer, and this spray dryer basically the decoction will be prepared separately. That decoction will be circulated into a spray dryer which is having pipeline and pipeline surrounded by the steam. Because of steam, the internal medicament, because all water soluble medicaments are the plant material, higher temperature will spoil those plant material. Therefore, every step is taken in order to protect the plant material and steam by controlled temperature only, the decoction water is evaporated. Then the uh, medicine powder has been dried. You see the conical chamber. If you send around 500 liters, you will get only one bag of powder. So it is a huge exercise, but it is worthy. And you see that from that conical chamber, underneath that a cloth bag will be there, plastic bag also we keep, and there we will collect the all the spray dryer powder. Every you see this is the powder, just like coffee powder, it will be visible. This coffee powder, we put nomenclature, it came in newspapers also, herbal coffee, by the name of herbal coffee for Ayurveda, from Ayurveda for the diabetic patients. Many newspapers has published and many number of patients today also they are asking for this medicine. This powder we have packed in a airtight wooden containers so that in order to protect the material by the entry of air and moisture and other atmospheric factors. You know, stability, shelf life, or expiry date, how it will be loosed by the medicines. It will be loosed by exposing air, which causes oxidation degradation. Because of moisture, it will medicine will spoil. Because of microorganism infection, medicine will spoil. For that we use the preservative, but here we don't use, we have not used any preservative, and we have uh, prepared scientifically using the traditional principles, and that powder we have used in prescribed quantity to put in the lukewarm water, and instantly we have prepared the decoction. Now the decoction has been studied. Now what we have done, ट्रेडिशनली जैसे घर में हम लोग कषाय बनाते काढ़ा बनाते उस तरह से बनाया लैब मॉडल, और ये स्प्रे ड्रायर पाउडर दोनों एनालिटिकल स्टडी किया गया, दोनों फार्माकोलॉजिकल स्टडी एनिमल्स में भी स्टडी किया अल्बिनो रैट्स में और दोनों क्लिनिकल स्टडी भी किया. Then we got very good wonderful results for the spray dryer powder. The reason is that spray dryer powder is a nanoparticle. Nanoparticles are very easily absorbable form of the particles from the alveoli of the intestines, since you are doing the seminar on Srotas. So, Annavaha Srotas is focused here, and these nanoparticles will be absorbed into the capillaries, further circulated in the hepatic circulation, metabolized and circulated to the heart, and circulating all over the body system and reduce the blood sugar. So this is the basic mechanism of the medicine, and all the analytical parameters which is requiring lot of time. So I will just briefly I will go, because Dr. Manjunath has given me 20 minutes time. I have to finalize these things very shortly. We have seen the any bacterial infection is present or not. Microbial load also we have checked as per the pharmacopoeial standards. We also seen for the heavy metal assay like mercury, cadmium, lead, and this arsenic, and all are in permissible limit. And you see, we have all the FTIR, Fourier transmission infrared spectroscopy screening of all the ingredients, and TLC, thin layer chromatography, as well for the phytoconstituents, and qualitative screening for alkaloids, glycosides, sugar, terpene, phenols, etc. We also done, and we also done oxidative stress examination also by using very sophisticated technology in Varanasi University. Almost all every profile of analytical study, animal study, we have completed. Unlike your modern medicine, allopathy medicine, we have established the tried to establish Ayurveda medicine also with a scientific basis, so that it can be used without any doubt by the world population. That was the main uh, the aim of this study. Here, aflatoxin activity we have studied, and TLC plates are shown here. This is the antioxidant study, how the oxidation degradation is taking place, that will be studied. Then in experimental study, we have seen basically antibiotic diabetic study. There is a chemical substance called streptozotocin. By using that injection, we can induce in animal the blood sugar. Diabetes can be induced, and after inducing the diabetes, the medicine is administered. The reason is that we have a concept that Ayurveda medicines will work very slowly, slowly. It is not like that. There are medicines which can work very rapidly. That is why Kashaya dosage bomb, where water soluble medicament absorbs very rapidly in the body system. We also have the asavarishta preparation, where alcohol soluble active ingredients, they also very rapidly absorb in the body system and produces the effect in the body system. So in anti-diabetic study, we have studied histopathological study we have done for its toxicity, acute toxicity, and subacute toxicity study we have done. All the results are displayed here. These slides you can copy at any time by requesting Dr. Manjunath ji. All the data is here and it is in public domain. All the papers are published in a website also, it is available. Further, we have done all the liver function tests and blood investigations of the animals also. those results also kept over here. This is how the animal is sacrificed from the our departmental laboratory is shown here, and their organs like kidney and liver, etc., brain, etc., taken and studied for the toxicity, because always safety is first, efficacy is second. So safety we have established. It is not that herbal medicine are completely safe. So any medicine, if you export to other countries like USA or any United Nations, they will ask for all the safety profile. So that Ayurveda medicines also are required to be established safety profile to meet the international standards, all the OECD guidelines which are required for the safety study over the animals. We have followed those guidelines. This is the total oxidant status. And now you see the clinical study. In clinical study, we have taken the parameters, subjective parameters and objective parameters. Among the objective parameters, we have taken fasting blood sugar, random blood sugar, and postprandial blood sugar. And most important parameter we have taken is the HbA1c, because glycolated hemoglobin A1c will be produced in bone marrow itself. It will be attached with the hemoglobin while its production in the RBC, from the RBC. So that whatever the glucose present in the attached with RBC is stable. So HbA1c, that is why every 3 months we study. We will take sample every 3 months. We need not to do daily HbA1c, because the fixed blood sugar will be there in the along with red blood cell. So HbA1c is a parameter worldwide, subjective parameter. If we established with these parameters, Western system also will accept our medicine. That was the aim of this selecting inclusion criteria and exclusion criteria. So all the patients are studied for different symptoms like polyuria, exhaustion, constipation, estimation of fasting blood sugar, postprandial HbA1c, etc. Finally, we have also seen liver function tests like serum glutamine pyruvic transaminase, SGPT, SGOT, etc., in order to see the effect over the liver also, and all the liver function test, renal function test also studied for every patient. And finally, we found that higher dose of Lodradi Kashaya, spray dryer powder, that is LKSD, lowers the blood sugar level more than the lower dose of LKSD. Actually, what we have done, Acharya Sharangdar in his Sharangdar Samhita has prescribed the dose of Kashaya. Based on that Kashaya dose, we evaporated and we estimated the extract of the Kashaya, and that Kashaya powder we have studied for a dose determination. So higher dose is as per the Saranga Samhita. I'm finishing. Higher dose is as per Saranga Samhita, and it will be having wonderful drug action by lowering the blood sugar. So that was found by throughout this study. And with this conclusion, okay. With this conclusion, I take this opportunity and mentioning that all the study we have published in different open access journals, it is available in public domain. At every time, anybody can access it. In the mobile also, they can see it. And I told that IKGT, CSIR publication journal also, such journals we have chosen for authentic publication of this study, and all the articles are published. So I have a great respect to Pandit Madan Mohan Malviya, because of whom the great Banaras Hindu University has been established. And that university has produced such a alumni like our GN Singh sir is standing over here, who have, like many of alumni in India and abroad, they have contributed to their field very tremendously, and he is the great founder of our university. Because of his efforts only university was made, Pandit Madan Mohan Malviya. Because of that, we could able to serve in the Banaras Hindu University. We got opportunity to work there, which is a great opportunity, I feel, and I utilize all the time in Banaras Hindu University for good positive work in Ayurveda. So, and also I am very much thankful to the organizers, particularly Dr. Manjunath and Dr. Vinamra Sharma and all our teaching faculty who has given me this opportunity to present some of the research work before you. I thank Dr. G.N. Singh ji for his gracious presence with my request over here. And I am also thankful to all you young generation. You are the persons inspires us. Because of you only we have to work. And you are the future upcoming Ayurveda uh, kingdom uh, soldiers. So you have to work in a right pathway in this great upcoming university. With all this, I once again congratulate you for this very good occasion of Dhanvantari, and also I thank all the university administration. Thank you very much. Namaskar.
Thank you so much, sir. Now I request Dr. G.N. Singh, sir, for a brief comment.
First of all, from bottom of my heart, I congratulate Dr. Ramchandra Reddy ji, who has given new look to the Ayurveda, starting from the preclinical studies to the clinical studies. As you are aware, lifestyle, the diseases have become a challenging issue for the people of this country and the globe. डॉक्टर साहब आपने जितनी अच्छी तरह से सारी चीज़ों को, विज्ञान को, उपचार को एक साथ पिरोहित किया है, ये बड़े सौभाग्य की बात है। जो आपने डायबिटीज़ के बारे में, जो अदर दवाइयों के बारे में केस स्टडी आपने बताई कि कैसे प्री क्लिनिकल स्टडीज़ की जाती है, क्लिनिकल स्टडीज़ की जाती है, क्या क्या पैरामीटर्स होते हैं और कैसे इतना सक्सेसफुल प्रोडक्ट आपने डेवलप किया, हम आपको साधुवाद देते हैं। और हम ये चाहेंगे नौजवानों को कि आने वाले समय में, देखिए ये अभी बहुत समझ में नहीं आएगा आप लोगों को, क्योंकि आप फर्स्ट ईयर सेकेंड ईयर के हैं, लेकिन आने वाले समय में ये सारी चीज़ें जब आप जानते रहेंगे तो प्री कोडेड माइंड सेट में आपके ये चीज़ें बैठ जाएंगी कि क्या क्या टॉक्सिक प्रोडक्ट्स होते हैं, हार्मफुल होते हैं। अल्फा टॉक्सिन के बारे में आपने बताया, कई चीज़ें ऐसी हैं जो जीवन में बड़ी काम देगी। तो आप लोग अभी से ध्यान दीजिए। इसी तरह से अपने अपने क्षेत्र में जो भी दवाइयाँ आप देख रहे हैं उनको वैलिडेट करिए, वेरीफाई करिए, उनको देखिए कि क्लिनिकल स्टडीज़ में कैसे सिग्निफिकेंट कंट्रीब्यूशन दे पाएंगी। और डॉक्टर रेड्डी साहब के हम बहुत आभारी हैं, जो काशी हिंदू विश्वविद्यालय से जब भी इस विश्वविद्यालय को ज़रूरत आती है आपका मार्गदर्शन मिलता रहता है। हमें पूरा भरोसा है कि भविष्य में भी आप ऐसे ही मार्गदर्शन देते रहेंगे, हम लोगों को नई दिशा देंगे और ये छात्र जहाँ भी जाएंगे वहाँ पर इस विश्वविद्यालय का, इस प्रदेश का और देश का नाम रोशन करेंगे। पुनः हमें ये सौभाग्य मिली है, इसलिए हम आपको बहुत आभार व्यक्त करते हैं। और डॉक्टर मंजूनाथ जी से निवेदन करेंगे कि मंजूनाथ जी एक बार केस स्टडी हम दे देंगे, आधा घंटा जब भी सब लोग इकट्ठा रहेंगे। देखिए हम अपनी केस स्टडी जो अभी हमने आप लोगों से वार्तालाप किया उसके बारे में हम एक छोटी चित्रवृत्ति बनवाए हुए हैं, उसको दिखाएंगे कैसे एक गाँव का आदमी, एक फार्मासिस्ट जो है वो मेहनत करते करते जो चीज़ कहता है, कैसे वो अपने जीवन में कहाँ कहाँ तक पहुँच पाता है। इसमें सब आप लोग देखिए, हम लोग तो पुराने हो गए हैं, हम लोग छोटी ऊंचाई को प्राप्त किए हैं, लेकिन हमें पूरा भरोसा है कि आप जितने लोग बैठे हैं, आज भारत बदला हुआ है, उसमें आपका विशेष योगदान होगा। मेहनत, परिश्रम, ईमानदारी, इन चीज़ों से आप करेंगे जो हमारे डॉक्टर रेड्डी साहब ने कहा है। और सबसे बड़ी बात है जो उन्होंने हमारे संस्थापक काशी हिंदू विश्वविद्यालय के जो मालवीय, मदन मोहन मालवीय जी थे, उन पे उन्होंने जो कही है उससे प्रेरणा लेंगे और उसी तरह का महायोगी गोरखनाथ विश्वविद्यालय का नाम करेंगे। इन्हीं शब्दों के साथ हम आपको बहुत ही आभार व्यक्त करते हैं। विशेष तौर से पुनः अपने रामचंद्र रेड्डी साहब को और इनका ये अच्छे प्रेजेंटेशन के सभी लोग तालियों के साथ इनका अभिनंदन करेंगे।
Thank you, sir. I take this opportunity to thank Dr. K.R.C. Reddy, sir, for sharing his valuable time and knowledge. Thank you, sir. I also thank Dr. G.N. Singh, sir, for chairing the session. Thank you, sir. शुरू शुरू